Welcome to the North Carolina Cancer Hospital and UNC Bone Marrow and Stem Cell Transplant Program. This educational series is a broad overview of the transplant experience at our hospital. Please view the information in addition to that which you will receive in the handbook that you'll get during your first visit. You are the key component to the success of your transplant, and learning about the process is a great way to start. We encourage you and your family to take notes and to write down questions so that you can review them with members of the transplant team at any time.
As you arrive onto the UNC campus, there are several parking options. Valet parking is available, and you can follow the signs for this service. Otherwise, parking is available across the street in the visitor's parking deck. An hourly fee will be charged and must be paid upon exiting the parking area. Please plan to arrive at least 30 minutes before your scheduled appointment. Upon entering the hospital, follow the signs to the elevator and take it to the second floor bone marrow transplant clinic. Be sure to bring your insurance card with you for your initial registration for this visit, as well as all future visits to UNC. Once on the second floor, please give your insurance information to the business associate at the registration desk. If you received a patient information sheet in the mail prior to your appointment, please have that filled out and available at check-in as well. We highly recommend that you bring a family member or friend with you during the first visit. They can help you listen to what's being said during the consultation. A caregiver will be an important part of your transplant team.
Mr. Johnson. Yes.
Once you enter the bone marrow transplant clinic, a staff member will greet you, then take your blood pressure, pulse, temperature, and respiratory rate. They will also check your height and weight. The staff member will also ask you some questions about your health, as well as the name and dosages of all medications you are currently taking. It is often helpful to make a list of your medications and dosages to bring with you, or you can bring in your medicine bottles for the staff to review.
Hey, Mr. Johnson. I'm Dr. Shea. Nice to meet you, sir.
At this initial consult, you will meet several members of the BMT team. The transplant physician will discuss a bone marrow or stem cell transplant as a potential treatment option. He or she will have reviewed your records previously sent by your referring doctor, but will still need to ask you many questions to complete an accurate history and assessment. During this consultation, you will also have a physical examination. The doctor will listen to your heart and lungs, look into your eyes, mouth, and ears, press on your stomach, and ask how you are feeling.
Let's go ahead and talk a little bit about what to expect then. But before I do, let me just ask you,
when the transplant physician is done with the examination, he or she will review the plan with you, including what his or her recommendations are. Sometimes more treatment is necessary before you are deemed a transplant candidate. Other times, transplant will be recommended as your next course of therapy. The transplant physician will also decide what type of transplant you will need.
Reason for consultation, a second opinion regarding this 57-year-old man with a recent diagnosis of multiple myeloma.
The transplant physician's recommendations will be dictated into a consultation note that will be provided for your referring physician. This consultation note will outline the recommended plan of care for you. Occasionally, the transplant physician will need to speak directly with your referring physician and will do so if needed. Depending upon what your disease is and the recommendation of the transplant physician, the two types of transplants that could be recommended are an autologous transplant or an allogeneic transplant. With an autologous transplant, patients receive cells from themselves. With an allogeneic transplant, patients receive cells from someone else. There are several types of cell sources that are used for transplant. Bone marrow is obtained via a surgical procedure in the operating room. Peripheral blood stem cells, or PBSCs, are stimulated with medication that causes the body to produce special cells in the bone marrow that then travel into the bloodstream. These cells are collected during a process which is similar to donating platelets. Lastly, umbilical cord blood can be used as a source of stem cells. The umbilical cord blood is obtained when the placenta is delivered. This umbilical cord blood is very rich in the unique type of cells that are needed for transplant. Your transplant physician will decide if bone marrow, PBSCs, or an umbilical cord blood is right for your situation. The transplant physician may order some blood work to be drawn and other tests too if your current clinical condition requires them. At times, a bone marrow biopsy will be performed, but this will only be done if necessary. Mostly this visit is to get to know one another and create a plan for your care.
Mr. Miss Johnson?
Yes.
Hi, I'm Debbie Covington. How are you?
Nice to see you, Debbie.
I am the transplant coordinator, and that means
You will meet other key members of the BMT team during this initial consultation.
you just now met with Dr.
A transplant coordinator will be assigned to you during this visit, who you will meet with either before or after you see the physician.
Be looking at it.
The role of the transplant coordinator is to guide you through the BMT process. Your transplant coordinator acts as an educator,
I would like to
an
introduce
advocate,
you to another
and the liaison between you, your referring physician, and the transplant team.
Go out here and I'll introduce you
The transplant coordinator will organize your pre-transplant workup, search for a donor if needed, and arrange for your workup prior to admission. During your first visit, you will also meet with the BMT financial coordinator. The financial coordinator will review your transplant benefits, whether or not you have any travel and lodging coverage, and provide recommendations for fundraising if necessary. The financial coordinator will also be your UNC contact for any transplant-related billing questions.
According to the benefits they gave me, you have a $500 deductible, which they said you had met, and then they will cover your transplant at 80%.
Hi, I'm Kathy Roundtree.
Hi,
I'm a
Kathy.
bone marrow transplant social worker.
I'm Ken.
You will also meet the BMT social worker during this visit. The social worker will ask you many questions to make sure you have all of the resources in place to proceed with transplant from a social perspective. If you do not, the social worker can help you create a plan.
Have you had any home health before, or done any kind of caregiving with him previously? No.
All of our transplant patients will require a designated caregiver, either one person or several, who will be available to help you when you are discharged from the hospital. The social worker can help you identify this person. The social worker will also be available to provide support to you and your family throughout the transplant process.
One of them is the smaller program.
Your initial consultation may be a long day for you. A lot of information will be provided, and you may have more questions once you return home and begin reviewing the material that was given to you. Before you leave, you will have a tentative plan in place about what happens from this point on. Further tests may be needed to make sure you're ready to proceed with transplant. Further therapy may be recommended before you can proceed, or you may be able to return for your pre-transplant workup in a short time frame. Once you return home, please contact your transplant coordinator for any questions you may have. Your transplant coordinator will be able to guide you through the steps that will be necessary to move forward toward transplant.